My name is Mohamed Abdel-Wahab. I'm a professor of interventional cardiology, and I'm working as an interventional cardiologist at the Leipzig Heart Center in Germany. And the study we are discussing or presenting today is the choice closure study. This study examined two different techniques of large bore vascular access site closure during transfemoral TAVI. And procedures requiring large bore vascular access have increased in the last years in interventional cardiology practice. They include, of course, transfemoral TAVI, but also include other procedures such as mechanical circulatory assist devices and endovascular aortic procedures. And for a large period of time, the options we had were limited. They were mainly based on suture-based techniques. And in the last few years, alternative techniques, depending on using plug-based technology, have been introduced. So currently we have a variety of closure techniques based on different device technologies, but randomized comparisons in large randomized studies have been very scarce. And this is why we think the study was necessary, and this is why we performed the study. So this study, the choice closure study, included 516 patients undergoing transfemoral TAVI at 3 German centers. These patients were assessed by a heart team, and they were all deemed suitable for treatment through the transfemoral access route. And they were randomized 1-to-1 between two closure device techniques. One is what we call the pure plug-based technique using the so-called MANTA device. And the other group was randomized to what we call a primary suture-based closure technique using a double ProGlide technique, complemented by a small plug if necessary.